welcome to the annual statewide Child Abuse Prevention Planning Convening hosted by California Department of Social Services, CWDA Child and Family Enrichment Cabinet, the Mental Health Services Oversight and Accountability Commission, Strategies TA, Child and Family Policy Institute of California, and Chief Probation Officers of California. We will hear a welcome by CDSS. We will get an overview of the Family First Prevention Services Program. We will have the opportunity to learn about Sacramento's prevention planning journey. We will have a break, and we will get to hear about the data playbook by Paul Collier. Today, we'll also be able to engage in regional breakouts, and we will have a closing today as well. Before we begin, it looks like some of you have started already, so thank you so much. But we'd like to know who's here today, who's in the room. And again, my name is Lydia Marquez. I'm a Senior Technical Assistant Specialist with Strategies TA, and I'm joining you from Orange County today. So to get us started, I wanted to just welcome Cheryl Treadwell, Branch Chief of the Safety, Prevention, and Early Intervention Branch with the California Department of Social Services, who's going to start us off this morning.
Good morning, everyone. Just briefly wanted to say good morning and welcome back to day 2. We have a robust agenda this morning. Appreciate all of you and your strong interest in supporting families in all sectors, and just want to acknowledge that we are continuing on this journey. We're here to provide the support that you need. I know yesterday was a contextual setting overview, and you got some inspiration by listening to Alice Morales. So hope you carry that spirit on today with the agenda that we have. And I won't hold you up without further ado, and I'll just let this day get started. And I hope that you're energized and motivated to continue forward with doing this work. So keeping in mind the purpose that we're doing this all for the good of families, including our probation youth. And I'm very excited that it looks like for this second day that we have a really robust cross-sector of representation at every level. So I am looking forward to hearing about the end of this day and how beneficial it has been for all of you. So welcome and thank you, and I'll pass it back to you, Lydia.
Thank you so much, Cheryl. We're going to launch a poll, and this is a poll just for us to understand, what do you know about Family First Prevention Services Program? So the poll is, how would you rate your level of understanding comprehensive prevention planning? Are you the guru? Could you lead this meeting? If you are, I can pass the mic over to you. Are you very familiar? Are you somewhat familiar, or comprehensive what? And if you haven't had your coffee, you might be there. So please go ahead and select how you're feeling today. So it looks like 37% are familiar, 31% are somewhat familiar, 18% are very familiar, and 2% could lead this meeting, and comprehensive what 13%. So definitely sounds like some people have some knowledge, but this today will be an opportunity, of course, to learn much more. And speaking of which, we will go ahead and hear from Frenny Desai from the Office of Child Abuse Prevention and Kelly Winston from Family Centered Safety and Support Bureau. Both are from the Safety, Prevention, and Early Intervention Branch. So we'll go ahead and pass it to Kelly and Frenny.
Hi, good morning, everyone. My name is Frenny Desai. I work for the Office of Child Abuse Prevention at the California Department of Social Services. And here is, along with me, is our Bureau Chief, Kelly Winston. And I just wanted to welcome everyone this morning. Many of us here have been working on prevention planning teams with the original 23 teams that participated in the summit in 2019 and have really been champions of prevention planning work. And those that have come on board after the summit with the support of our Strategies TA. So thank you, Lydia, and Michael Williams, and Sarah LaCroix for all your support. And I just want to acknowledge all the hard work of all our prevention planning teams over the last 2.5 years who have done wonderful work as we continue our work towards making a continuum of care for all of prevention services.
Thank you, Franny. So I did just want to acknowledge that we also have some folks here, according to the poll, who are a little bit new to prevention planning teams. We want to acknowledge that you're here and excited to do this work. And we want you to come along with us. So we're going to do a little bit of background work to talk about where we've been. And the purpose of this is really to explain how all of the pieces of the different elements of the Family First Prevention Program here in California work together to create the way in which you all will be doing prevention planning as we move forward. So this slide you saw yesterday, if you were with us, Cheryl talked a little bit about how all these pieces work together, but we're going to dive in just a little bit deeper to make sure everybody is up to speed. Some of this may be a little bit duplicative for folks. And then what we're really trying to do is focus on where we at now and how does each of these pieces work together so that you're all set up to develop your own local comprehensive prevention programs. So we'll start with the Family First Prevention Service Act. So most of you are really familiar with FFPSA, but just wanted to set the context by talking a little bit about this very complex law. Has multiple pieces to it, but of course for today we're really focused on part one. And you know, this really is a great federal law. It allows us to draw down Title 40 funding and reimbursement for these mental health, substance abuse treatment programs and in-home parenting skills. This program is really intended for candidates for prevention services or those children who are at imminent risk of entering foster care, and then also for their family members who can participate in those services. The program goals under the federal law are really to decrease foster care placements, increase that ability for kinship support so that when possible, youth who are potentially entering our system are able to be with their family members and folks that they know, and really decrease that trauma that they may experience when entering foster care. And then really the crux of prevention is to increase opportunities to ensure family well-being at the earliest point possible. One of the aspects we always like to point out for the federal prevention program is that concept of payer of last resort, where typically we see Medi-Cal in that payer of last resort bucket. But for this one, it's a little bit different where Title 4E becomes the payer of last resort. So some of the complexity we're going to talk about over the next couple of days is really thinking about how that process works. And then just highlighting some of the additional features of the federal law, our requirements for continuous quality improvement and model fidelity of the services that we put in place, the requirements for a professionally trained workforce, and then additional requirements for data reporting, which includes per child expenditures, which is something that we've not had to do in the past. So the next piece in the puzzle for our prevention services program in California is the 5-year prevention plan that California is in the process of working through. So many of you know that last August, we submitted our first draft of our prevention plan to ACF for approval. And they went through and gave us a lot of really good feedback where they asked for some additional details and clarification for some of the things that we had already included in the plan. But then some areas where we really did some restructuring and building out with quite a lot more detail. Those are the items in the yellow that you see there, where we really built out our continuous quality improvement approach. We added a lot more information and detail about how those pieces will work together. And then in addition, we talked a lot about the local agency opt-in process, as well as how we were going to structure our training to ensure that we have that workforce training and development that is required for the federal law. I always like to highlight that this prevention plan is really about how we're going to include the federal law in California's approach to prevention. This is really how we are going to ensure that we can engage activities that will draw down that Title 4E federal match to support ongoing prevention work that California wants to put into place. The plan also includes our vision. You can see the original kind of items up there in white, but it includes our vision for equity and inclusion, for reducing disproportionality and disparities in the system, and really our effort to try and ensure that we utilize the expertise in our local communities to ensure that we get the right services in place. So it's a balance of that federal need versus how the state is going to implement this federal law. And really the purpose of the plan is to ensure that we're able to opt into the program and expand upon what we see that federal law being is somewhat limited to a more comprehensive approach in California. This next slide really covers how, and again, many of you have probably seen this before. This slide hasn't changed a whole lot since the first time most of you have seen it. Really identifies how we have identified the Family First Prevention Services Federal Act into state law, but then we also go beyond these elements in FFPSA to describe how we want to go upstream a bit more than what the feds had imagined and really cover a comprehensive approach to prevention. So through this law, we were able to expand to comprehensive prevention services, which include primary and secondary services, as well as the tertiary services that FFPSA provides for, with those evidence-based programs that are mental health, substance use treatment, and in-home parenting skills. So this really allows us to include a lot of different types of services. And we'll talk about the state block grant in just a minute, which helps to fund those services. But in addition to those basic requirements in the federal law, we have also expanded to ensure that the program in California is consistent with the vision that we describe in our state prevention plan, and that we really have this cross-sector collaboration to ensure that the programs we select in California meet the needs of those that we believe should be prioritized, and really to punch up that concept of the importance of equity inclusion and reducing disproportionality in our system. All County Letter 2223. This is a letter that describes our state block grant and our approach to comprehensive prevention planning. So many of you are aware that the state has allocated $199 million to be expended over 3 years. And the letter talks a lot about what are the different activities that counties can claim under the Title 4E portions of this program, and then also what can be claimed under the FFPS state block grant. So that block grant really allows us to do the work that goes beyond the federal law. And so this letter is the document that helps explain those requirements. In addition, it lays out all of the elements that are to be included in local comprehensive prevention plans and the due dates for those plans. So many counties have already opted in by providing a letter of intent so that they could obtain early access to the state block grant funds and start really thinking about how they're going to plan and come together to develop the elements that they want to include at the local level. By April of these last few months, we received letters of intent from 49 counties across the state, which is very exciting. And so that enables them to use that funding to develop their comprehensive prevention plan. Those prevention plans are due by January 31st of 2023. So right now is when the really intensive work is truly beginning. And we're excited to give you a lot of things to think about today that will help you do a lot of that work at the local level. A couple of things we like to identify is just really a couple of concepts around maintenance of effort. So maintenance of effort is a federal requirement where we need to ensure that we maintain previous levels of prevention spending. And really all that means is that the federal government looks back to 2016, where we established how much money we were spending on the prevention programs that were included in our prevention plan that we submitted last August, and our commitment to maintain those previous levels of spending. So we're in the process of figuring out what the burden will be for each county who's opting into the program. We won't know the total dollar amount for that until we get every single comprehensive prevention plan submitted. So more to come on that. And then the state block grant letter really does include some good information around how counties can obtain technical assistance. Some of that is for work in developing capacity at the local level for really being, having a system that's ready for change and to do that upstream prevention work that we've not been able to do in the past. And then also to really think through how to get ready to implement those services. So really good information in there about things to think about for capacity building and readiness that Franny will be talking about a little bit more. So I wanted to just kind of highlight a few of the examples where you can kind of see the differences between what you can use some of the Title IV funding services for. So again, this is really about what's contained in our 5-year prevention plan. So these are really those tertiary prevention services. What's in the federal plan is all of the well-supported services that were in the federal clearinghouse at the time that we first submitted our plan. And in order for counties to be able to draw down Title IV funding, the services have to be in the California Prevention Plan. I always like to call out too that our state law says that we'll be reviewing that plan once it's approved on an annual basis. So we have the flexibility to add additional plans or services over time and make any other changes in the plan that we provide to the federal government as we learn more about what we need in California and where we'd like to grow. The population served by the Title IV funded services, again, our candidates for foster care is determined by a Title IV agency, and then those services can also benefit the members of their family. The federal law also calls out expectant or parenting youth, and we never want to forget about those youth. They're the only part of the prevention services program that can actually be in foster care and benefit from those services. And then additional activities that can be claimed under 4E are related administrative and training costs. These are costs that if you're planning your prevention services program and helping to develop your Title 4E eligible services, those are costs that can be claimed with the 4E dollar. And you can see in the right-hand column of this section, this slide, the services that we already have included in the state's prevention plan. And so this slide, again, has examples of what can be supported by the state block grant. You can see that this is quite a bit more expansive. So this includes primary, secondary, and tertiary services. This is really any primary or secondary prevention services that can meet your local needs. We really wanted to place the emphasis on services that are culturally responsive to your community's needs. That is something that we have really tried to identify as part of our vision for prevention in California. But we also want to highlight that you can also use these funds to support EBPs that were not included in the state's prevention plan, if that's something that best benefits your local needs. And really the population served here is dependent upon what your needs are at the local level. So lots of flexibility in who you can serve as compared to what is eligible under Title 4E. And then again, additional activities that you can claim under this block grant are other planning activities that go beyond the Title 4E program. And then, how you might think about building sustainable prevention infrastructure using other ongoing prevention funding sources that you'll hear a bit more about tomorrow. And then, again, the services on the right-hand side of this slide really talk about the flexibility and what you can do using state block grant dollars. Okay, and then I just use this slide to bookend. It really is pulling this all together, how federal law, the prevention plan, the state block grant, and the state laws support this different kind of prevention services program in California. And this is what we had to put in place in order for counties to be able to get to the point to start building their comprehensive prevention plans. I'm going to hand it over to Franny at this point because she's going to go in a lot more detail about what that will look like and what you can expect to see today that will help you build those plans.
So this slide really demonstrates about our Family First Prevention Services program. As you know, it's part of AB 153, and it's really our state block grant that allows us to fund that comprehensive prevention planning. And just as a reminder, our state block grant really is an opportunity for planning and direct services. You can use its flexible funding to be used in both instances. The comprehensive plan should incorporate both primary, secondary prevention strategies, and then of course tertiary prevention strategies as well. But our tertiary prevention strategies are really focused on that FFPSA Part 1. So if you think of it, it's the entire continuum, and FFPSA Part 1 is a portion of that larger system that we're looking for. And the state block grant was an opportunity, as Kelly has kind of mentioned before, is to expand on FFPSA Part 1, because the FFPSA Part 1 does have its constraints in the target population that it can serve. Whereas the Family First Prevention Services program is much more expansive. And just as a reminder, it's really been established through Welfare and Institutions Code 16588. And we hope that this whole system will support the ability of parents and families to provide safe, stable, and nurturing environments for their children. This slide really depicts our community pathway. And some of you folks on the line may have already seen this community pathway as in the past, if you've read our draft plan to ACF. But as a part of the comprehensive prevention plan, a planning team may choose, this is optional, to implement a community pathway as a way to reach families before system involvement. That's what we're hoping for within this community pathway. This pathway requires a partnership between community-based agencies to assess families, determine candidacy, and develop prevention plans and coordinate delivery of services, and as well monitor the prevention plan, including risk and safety. And Title IV agencies have the option to designate and contract with local service providers to engage with the family and coordinate receiving services and possibly other services funded by the block grant or other funding. So you can use this to engage families in 4E services or other services that could be funded by the block grant or other OCAP funding in some instances. Just as a reminder, the community pathway, the services are voluntary, and case management is done by the community-based organization who has contracted with the 4E agency to provide the Family First Prevention Services program. This could be a school-based service, a behavioral health organization, a family resource center, or a tribal service provider. And how are families referred to the community pathway? It could be self-referral. They could be referred directly from a CBO or another association, such as a school or behavioral health organization. Or they also may be referred through the Child Welfare Services Agency when a referral doesn't meet the criteria for investigation. So just as a reminder, we have options for pathways within our plan. As part of the comprehensive prevention plan, there are 2 options of pathways for children and families to receive services. To be reimbursed specifically for 4E services that are evidence-based in the state prevention plan. And the first one is this Title 4E pathway. And it's really our traditional pathway of voluntary court-ordered family maintenance cases or post-family reunification. Referrals in this traditional pathway will come straight from the child abuse hotline and offers Title 4E for services for children and family members. Oversight and case management is again done by the Child Welfare Agency in this case. And services may include non-4E eligible services, just as we do traditionally with child welfare. And it's hopefully the goal is to improve upon the traditional practices and success rates for these families using this 4E pathway. Now, the other option is what we just described before is a community pathway. And again, referrals can come from anywhere. This is not just our traditional Title 4E, Child Welfare Agency hotline. Services are voluntary, and engagement strategies such as motivational interviewing can be used to help develop rapport with our families and really engage families in the process. And the idea is hopefully to reduce the stigma with child welfare involvement. And the ultimate goal is, of course, to reduce disproportionality and disparities for families of color. So what are the components of the comprehensive prevention plan? What is actually required by the plan? Results of your pre-work and description of how your target population and services were chosen is really important in this process. We really have to engage collaborative partners across the board. Our multidisciplinary partners are essential to this work. Those with lived expertise are essential to this work. We must engage them from the beginning and include them as part of the planning and implementation process. So when you're thinking of starting, let's look first at our collaborative partners and engaging with our folks that have lived experience. And being sure to thread equity throughout the planning process by starting with engaging the community. And this step is key to gathering data from family experiences is essential to really developing your plan. It really helps us understand what are the needs, what are the services that need to be targeted, and how can we make the system better for everyone. Some of these components may be similar to the work that your agency or services sectors have already completed. It's really important to leverage those processes and information. Really, and that's one way to engage your external partners as well, your behavioral health, your Department of Education, your law enforcement, whoever will be at the table, public health, and really setting up a structure and a governance structure is also essential to this work, because that way it's a system and a process that's in place that can help you speed the process along and make sure that you're tapping into every planning and implementation need that there is. And again, needs assessment is also a critical component. So your agency may have already completed a needs assessment process. I've been asked this question in the past. What about our county self-assessment processes that we use in child welfare? Can we use that to leverage this work? Yes, use your processes that are already in place to leverage. If you already have an established team, such as an AB 2083 team and an MOU that's already established, a charter, use those systems and processes to really move forward with this work. We don't want you to have to reinvent the wheel, but these systems are in place to hopefully coordinate and lead to better access of care and services for all kids. This slide is really an overview of the planning and implementation process. This is a roadmap, and it really is to develop a comprehensive plan and implementation of services. Implementation means like putting the plan into action from the beginning to the end. So we're really thinking about what is the guidance and information? What is your process for capacity building? How are you ready to develop your plan? And what is the next step to really begin implementation? And as you can see, the capacity assessment falls within the capacity building phase. This capacity assessment you'll find in the ACL 22-23. And it's basically an opportunity to really look at motivation for change. And we'll go into that in a bit more detail in a few minutes. Another piece of the capacity phase is really looking at your asset mapping. What are your needs assessments? What is the data that's telling you? Get your partners together. Talk about the data points. And Paul Collier later today will kind of explain data and give us a good overview of how we can use data to really develop our comprehensive prevention plans. These phases are provided with flexibility for counties to start at their appropriate point of readiness. We know every county is at a different stage right now. We know some have done this planning work for a couple of years now, and others are just embarking on this planning work, and that's great. And so we're here to provide the support. So most of us are kind of in this stage, this pre-work stage that we're developing the plan. In this phase, the county is really identifying your partners. You're gathering the data again. You're targeting, you're determining what target population you're going to be serving so that we can really make decisions that will impact a good comprehensive prevention plan in the near future. This includes asset mapping, which is essentially a landscape scan of your current prevention. What is the purpose of our capacity assessment tool? As I mentioned, the capacity assessment tool is available through a link, and it's essentially just a survey that's within this link. And we encourage you to work with your partners to really fill out this capacity assessment. There's downloadable version as well that you can go through and then upload that information into the link. And that allows us to also see where your needs might be. Have you really established a group of folks that are ready for and motivated for change? That's our first thing. Are you ready for planning? Are your team members ready for planning? Do you have leadership support? Next is really looking at provider capacity and their capability. Do your providers have the support they need to build capacity? Do they have the capability? Do they have the funds? Do they have all the resources necessary to really build out a comprehensive prevention plan? Next is their systems capacity and the infrastructure. Do we have the infrastructure to really meet the needs of the population based on our assessments, based on what we know about our community needs? And do we have that motivation for change? And really, finally, it's that policy supports. What's next? What do you need to develop internally to really move the system forward? What are the policies and the infrastructure that needs to be put into place? And again, we're available to help with support in looking at your capacity assessments and helping you walk through this process. And it's available in the ACL that Kelly and I have mentioned, the ACL 22. So how does the team get started, or what prior work can my team leverage? So we heard yesterday from San Diego about startup activities for their team. They talked about partner engagement, transition planning, kickoff events, partner recruitment activities, work groups, and an advisor committee. Co-creation of a project vision is essential. Amy also talked about shared values and principles, roles, and responsibilities. Really getting a theory of change in place. What are your strategies? What are your activities and your priorities? Doing that logic model, knowing what your outcomes are going to be in the next 2 years, 3 years, 5 years. And doing that landscape scan. Increasing, the ultimate goal is what are we trying to achieve with comprehensive prevention? And we're trying to hopefully increase protective factors, increase family and child well-being, and hopefully decrease likelihood of child maltreatment and those adverse childhood experiences. That is our ultimate goal. And we hope that with early interventions and early prevention activities, we can reach that goal. And as this slide really walks through that process with you. So think about your cross-sector collaboration practices. Think about who those folks are going to be at your table that can help you move the needle forward. Complete that capacity assessment. And again, we're available for support to help you walk through that process. Establish a governance structure to help you kind of decide on what the steps are and make policy decisions. Engage your community. All folks, I know counties do this all the time. Engage your community as best as you can. They do it through the county self-assessment process. Utilize your partners to help engage the community for partners that you may not have on the table currently, but you know that are essential to this process. I remember working with Kern County as a prevention planning team, and we were talking about housing issues. We didn't have housing folks at the table, but engaging those stakeholders were essential to the process to think about strategies and plans for next steps. Asset mapping and gap analysis. Of course, this is essential. We've been talking about it all the way through. What is the needs? What are your strengths? What are the things that still need to be completed to make sure that families and children have the needed supports and services so that they aren't experiencing adverse childhood experiences. An analysis of your prevention services and your population served. Who is that target population? What are the outcomes? How have they reached those outcomes? And of course, always review your cross-sector collaboration. Who needs to be at the table? What is that data? And Paul will share with us a little bit more soon. And again, we are here to support you through this process. You're not doing this alone. We will try and do our best. This is kind of a joint collaboration to really support you as you develop your comprehensive prevention. So this slide is really talking about leveraging of funding to create a comprehensive prevention. So we have, of course, we've talked a lot about Title 40 FFPSA Part 1. That's our federal funds. And those are really towards our secondary and tertiary population. Those funds, again, as a reminder, they're reimbursement for those evidence-based practices. They're constrained in the sense that we can only use them towards our candidacy population. We can only use them for our tertiary and deep secondary population. And it's reimbursement. It is entitlement funds, but they are reimbursable. We have other funding sources available. We know that Title 40 FFPSA Part 1 can't do it all for us. So how do we build out our systems? How do we sustain our system that we develop after we have a comprehensive prevention plan developed? One is, of course, you can go back to our Family First Transitional Act funding. There's funding available that can be used at any of the 3 target populations, our primary population, secondary population, or tertiary population. It's pretty flexible in its funding. Next, our whole State Family First Prevention Services Program block grant, our AB 153 funds. Again, we've made this opportunity flexible so that we know that counties need this opportunity to build out their comprehensive plans. So this funding is available for primary, secondary, and tertiary activities, including planning activities. We know some of our OCAP funding is more restricted in those ways, but this funding is available for planning activities as well as expanding on direct service delivery. The next is promoting safe and stable families. Again, this is federal funding. This is OCAP funding, Office of Child Abuse Prevention funding. Counties are given an allocation for promoting safe and stable families. And this can be used across the board as well, primary, secondary, and tertiary. This is an annual allocation. So folks, this is not necessarily funds that are going to go away anytime soon. Our Family First Transitional Act, yes. Our state block grant, as you know, is a term limited. Title 4 FFPSA Part 1 might be entitled up. We don't know for how long. But our promoting safe and stable families, it's been here for a while, and we can anticipate that you can continue using it. Think about those funds for sustainability. We also have our American Rescue Plan Act, our ARPA, Community-Based Child Abuse Prevention Funding. And ARPA CBCAP funding is one-time funding, again. And the thing about ARPA CBCAP funding is essentially that it can only be used for primary and secondary services. It can be used, we've tried to make it as flexible as possible. There's no match with ARPA CBCAP funding. So it can also be used for planning activities. Folks, that most of our counties have, you had to submit a letter of intent to the Office of Child Abuse Prevention to receive this funding, and that funding should have gone out in April 2022. Please reach out to us if you haven't received that funding. But most counties did opt in for that funding. Again, this can be used in coordination with your Promoting Safe and Stable Families Act, your state block grants, FFTA funds, and of course, your Title 40 reimbursement funds of FFPSA. Then we have our community-based child abuse prevention funds. These are also primary and secondary. Both ARPA CBCAP and CBCAP cannot be used towards our tertiary population. That's why we're talking about leveraging and blending funding. It can only be used for prevention at primary and secondary levels. So, you know, a lot of folks have asked a question or kind of sometimes get confused about how FFPSA fits into the larger picture. So we've tried to describe that here. How does FFPSA really fit into the larger picture? We have the state block grant, and the state block grant is actually our large picture. It's our 153. It's flexible funding. It's for primary, secondary, and tertiary as our target population. Our Title 40 eligible services, that's our FFPSA Part 1 reimbursed funding. That is only for our tertiary population. Again, that's for our candidate population. That's much more restrictive than our state block grant or what we actually are starting to more closely refer to our state Family First Prevention Services Program block grant, which is established in 153. And here we have offered you a lot of tangible resources to prepare you today. So kind of, we're going to have a little bit of a discussion of where do you think you are going to need help as a county? What are you interested in implementing? And what hasn't been provided? And things to think of over the next 2 days is, how will your planning team engage the community? How will you define the role of behavioral health and your planning teams, within your planning teams? How will your planning teams involve individuals with lived expertise? What pathways is your planning team interested in implementing? What type of support or technical assistance can we provide at the state? And some of these, your governance structure, your team building, all of that will really depend on kind of what your services and what your next steps are. Really also going to depend on what your data shows. And Paul will get into that a little bit as we look into asset mapping and needs and strengths assessments.
So we had a question in the chat about if the state was working to get Triple P added. There are a lot of folks who have used this and invested a lot of time and money into this. And so I think there was just a question around that.
Yeah, I can try and answer that question. So one of the things that, Franny literally just talked about and we try to point out is for those programs who aren't currently in the prevention plan, you can still use state block grant funding to continue those programs moving forward. Now, having said that, we also have the opportunity to add programs to the prevention plan over time. The way that we approached our first round of our first version of the plan was to really focus on those well-supported activities so that we know that we can ensure the ability to continue to draw down 40 funds moving forward. We wanted to make sure that we were focused on stability and the ability to keep those Title 40 dollars coming in to support the state funds. Having said that, moving forward, we do want to support, the Triple P programs are definitely, in the clearinghouse, they're mostly rated as promising and supported. And there may be counties who want to put them into place so that we can continue to build evidence to get them up to that well-supported level. We may even have the ability to continue to support those programs over time. But the reimbursement rates for Title 4E are different if you're talking about well-supported versus promising and supported. So right now, they're not a part of the prevention plan. You can use state block grant funds for them. We hope to see those evidence-based ratings improve over time. And we may be able to support from a state level perspective some additional evidence-based or evidence building in the future. And we can partner with counties to do that in upcoming iterations of the plan potentially. So that's something that we're thinking about, and certainly appreciate hearing your feedback on what you're interested in partnering on those types of services.
Thank you so much, Kelly. I wanted to just highlight something that was typed in the chat by Richard Connect, where he says, on the broadest scale and within a system of care lens, there are additional funding sources from other partners that can also support a local comprehensive prevention plan. I'm not sure if Richard wanted to comment more on that. Or not.
Actually, I can touch upon that because of that funding leveraging slide. As yes, absolutely. I know counties have talked about sustainability. How do you sustain these programs? And essentially, we have to work with our partners. We're here for the same end goal. We're serving the same population. And that's the whole point of system of care, right? We're serving those same kids. We want to have the best outcomes and move towards well-being. And to do that, we have to look at our partners. They have funding available. They have resources. If we're serving the same populations, we want the same outcomes, we can look to our partners. This is the whole purpose of us really funding planning activities through the state block grant as well, is look to your partners. It's an opportunity to really engage everyone so that they also have outcomes that they have to reach and they have funding available. So if we can combine and leverage funding, what can we do? What can we possibly achieve if we really work together consistently and have a comprehensive plan that's really with the same outcomes and goals in mind? You can use those fundings for sustainability. I know that question comes a lot with our county, our current prevention planning teams.
Thank you, Franny. I think I've seen quite a few actually comments regarding like a cheat sheet that would help like assess like which funding could pay for what. I think just sort of like a little sort of like a cheat sheet, so to speak. Also, I just wanted to acknowledge a comment that someone was asking if there was a worksheet or formal document for the completion of the comprehensive prevention plan. So I'm not sure if someone wanted to comment on the resources that will be available for comprehensive prevention planning.
Yes, I think that's a very good question. So we are in the process of developing, really finalizing what we're calling our comprehensive prevention plan toolkit. And so a number of the items that are suggested in the chat will be included, including a funding guide, which will identify at least all of the funding sources available typically to child welfare services agencies. And I don't know if many of you may have noticed in the chat, Richard identified, he couldn't come off mute, but he identified quite a number of other funding sources that are available through our partners, like First Five, the Mental Health Services Act, CPA, and then local control dollars as well. So some of that will be available in the guide. There will also be a comprehensive prevention plan template for folks to use. Franny, do you want to comment on some of the other items available in the toolkit?
So there's a list of resources. Our partners here at Strategy STA have really developed a comprehensive toolkit to help. So of course, as Kelly mentioned, that there is the comprehensive prevention plan template. And within that, you will find a host of different resources. We're looking at disproportionality and disparity. We're looking at asset mapping. We're looking at of course, our readiness assessments, which we'll talk about further by Coach Cooper tomorrow. So it's really, as Kelly mentioned, we're trying to get out those tools as soon as possible. I did see that question come in. When is that? We're working as fast as we can. We've started the process for, we're just kind of clarifying, you know, what else is needed, and we'll have those posted on our website. But in Strategy CA, if you'd like to also share kind of what is in that comprehensive prevention plan toolkit.
I'm going to drop in the chat a link to our website, because we have some resources that are part of the toolkit. And so you can peruse that and look to see just some of the things that will be sort of like a preview to that. So I'm not sure if anyone else would like to share some more details about that.
I see Linda from San Luis Obispo has her hand up. I don't know if anybody can unmute her so she can ask a question.
Thanks so much. I just had a question. I missed on one of the earlier slides you had outlined a 4E pathway and then the community pathway, and I missed part of that. I just wanted to clarify my understanding, because what I thought I heard is that the 4E pathway, that the oversight and case management for that has to be done by child welfare services. And I just wanted to clarify, does that mean that to access that 4E funding, that it has to be through child welfare services providing that, or can 4E dollars be claimed if they're following that community pathway entry point?
So the eligibility for 4E services isn't limited to one pathway or the other. You can use and draw down 4E funding for either a community pathway or a Title 4E pathway. It's just really about how the services function and who does the case management. In the community pathway, we really designed that in such a way where we're trying to have as light a touch from the Title 4E agency as possible. It's really our effort to get as far upstream as possible and ensure that that families get the services that they need, or the child welfare is really the case manager of those services. So it's really about the separation of the systems. Now, having said that, a lot of the services that are available in the community pathway are also 4E eligible. And really it's up to you and your county about how you design that. Some counties may choose to do only a Title 4E pathway and have their own staff do the case management services. Other counties may only choose to do a community pathway. Some may do some combination of both. It really is about what your local needs are and the services that you want to be able to either continue or increase capacity for. Lots of flexibility there.
All right. So I think there was some folks that were asking about the deadline for the comprehensive prevention plan, and if there's any talk about possibly extending that date just due to what some people feel are very tight timelines.
I think the thing we're trying to balance with the January deadline is the length of time that the state block grant is available. We want to be able to ensure that counties have time to expend those funds. And so that's where we struck the balance between later plans being accepted versus keeping to a tighter deadline. We're already well into the first year of the ability to spend those funds, and we hope that counties are starting to use those in developing the prevention plans. And now, having said that, January may come and we may have a different landscape on our hands and have to rethink, how this work is going. And so obviously things could change, but at this point, I think we're trying to get as much work done to get those plans in place so that we can take as much advantage of those funds as we can.
So, excuse me, I'm just being mindful of time and see that this is a great conversation, but I do want to allow us to have enough time to highlight Sacramento County. So if there's other questions, we'll have some other opportunities for discussions. And I think that also, I believe that there is an FFPSA email that you can send specific questions to. So we'll go ahead and put that information in the chat later as well. So next, we're going to highlight Sacramento County. the Sacramento County Prevention Planning Journey. We're very excited and honored to welcome Sheila Boxley, the President and CEO of the Child Abuse Prevention Center, and Michelle Callejas, Director of Sacramento County Children of Family, Child, Family, and Adult Services. So welcome. It's a mouthful. Thank you so much. Welcome.
Good morning. Thank you so much. We're delighted to be here today. We are on the same journey as all the rest of you and all the other counties. And so hoping to learn from each other today and tomorrow, and obviously starting yesterday. Michelle and I wanted to start out with a story. It is a true story about something that happened in Sacramento County. And the story starts out really kind of sad, because about 25 years ago, over a period of about 18 months, we had a series of really tragic child deaths due to child abuse and neglect. All very young children, very prominent in the headlines. And I can assure you that all of the news feeds were all about this, on and on and on. The community was upset. The county departments were under fire. The county board of supervisors were being talked about in op-eds pretty much daily. And so it was a really serious time. So I think those of you maybe who have been around for a while know that when things like this happen, there sometimes is a knee-jerk reaction. Well, let's put up the barricades. Let's go internal. Let's be really sure that nobody can die, because we're going to have them all under surveillance, and we're going to have more kids substantiated and put into foster care and so on. And we've seen that has happened before in communities. That's not what happened in Sacramento County then. Something very different happened. So in this story, you have some characters, and some of those characters include pretty much brand new director of child welfare and director of the CAPC. So they didn't come with a whole lot of baggage to this, and were barely starting to work with each other, but came to realize that both had been really looking at some evidence-based prevention programs and models, and thinking that there needed to be some changes. Another character in this story was a champion on the board of supervisors, who really believed in prevention and going farther back and helping families and communities. There were also some additional characters in that over 20 organizations, both public and private, were already working together for over a decade in a child death review team. And they had been collecting data, not just on children who were suspected of child abuse, but looking at all child deaths. And so there was a plethora of information available. Just so happened that at this point in time, it was time for the annual report from the Child Death Review Team to be presented to the Board of Supervisors. And you can imagine in the environment that we were in, that the press was right there waiting for that presentation and for those recommendations. Those recommendations were from all 20 plus organizations, but it was the responsibility of the CAPC director to provide the overview and the recommendations. So the primary recommendation was, let's get serious about doing some prevention. And there are some existing models, particularly home visitation at that point in time, that we know are working in other places. So let's start to do it differently. And so next to the CAPC director was the child welfare director, agreeing to that same recommendation and knowing it was on behalf of all those other organizations. It was a great opportunity, frankly, for the Board of Supervisors, because, okay, you guys have given us a solution, it's in your hands. And they did very much put it in the hands of the organizations. And that champion said, okay, you two directors, here's what I want, and it has to be done in 6 weeks. I want you to get together. I want you to have a big convening. I want you to engage anybody and everybody, from neighborhood associations to providers, to individuals, to advocates. you need to bring everybody in and really talk about very specifically within 6 weeks what the programs are that need to happen, where they need to happen, et cetera. Well, the two directors said, of course, we'll do that, and then walked outside and went, oh my goodness, be careful what you ask for. But what happened was that they had to pull their teams together into one team to really get that work done and to make it happen in time, because this was the opportunity. And indeed, there was this giant convening, in addition to all kinds of focus groups and other kind of outreach. We brought in the national experts in Healthy Families America, Nurse Family Partnership, et cetera, et cetera. Well, this is what the community said back. They said, yes, we want those home visitation programs, but we don't want them in the county or in some big building. We want them deep inside our communities. And so what they were asking for were family resource centers embedded with home visitation. That's what happened. And within 6 weeks, because of all the data that we had already about where the needs were and so on, we went back, those two directors, and said, these are the programs. This is where they need to be in the community. This is what the community has asked for. And in one instant, the champion said, we're going to give you $7 million and go make it happen. But we want to hear back every year about what you're doing and what the differences are and what changes you've made. So what really happened then was a culture came about of transparency, of collaboration, of shared responsibilities. And what we had in that time, which has continued in Sacramento County, is very much what is helping in this process now of doing the planning that we all are engaged in. We had leadership that was committed to prevention, that had a shared vision of what needed to happen. We had community input and engagement, probably more than I've seen before at any one time, with really, really deep into communities and also providers of all kinds, public and private. Cross-sector, we already had an existing collaboration of over 20 organizations that have been working together as the Child Death Review Team, and that sort of morphed into a family support collaborative that began to really look over and have responsibility for this new program. And then data. We had a lot of data. I want to give a plug. If you don't have an active child death review team in your community, really think about it. It has been the pivot for major policy changes because of the strength of the data and the collaboration of all the organizations that are involved. There's one more element that was present then that's present now, and I'll turn that over to Michelle.
Thank you, Sheila, and good morning, everyone. So the shared power is such an important component of doing this work within our community. And I don't think that there's any child welfare director in the state that wouldn't say we cannot do this work alone. We've got to have community partners. We need folks who are going to have a shared responsibility, shared accountability. And the only way to get there is for us to be willing to share power, to share decision-making, to utilize what we did with this approach and a more recent approach, having a backbone agency like Child Abuse Prevention Council to administer the funding with community-based partners that we all know are more trusted than child welfare agencies, but they can help support the work that we do. And they are so effective. They're in the community, they're on the lines, they're trusted by community. And so we have to be willing to share that power and allow for decisions to be made outside of us. And that can be difficult at times, but what I continue to learn is to trust the process, to trust the community. It's why we engage families and youth and get their voice, because they know more than we do what they really need. So yesterday, Stuart Oppenheim gave kind of a great summary of how we got started on this journey of prevention. So I won't go into all the details, but I will just share that we had a speaker come to our Child Welfare Directors Association meeting, I think late 17, early 2018, Robin Jenkins, who's a professor out of University of North Carolina at Chapel Hill. And he's amazing. He's an amazing speaker, dynamic, and such an advocate, and so passionate in the area of prevention. And he's worked in law enforcement and substance use and mental health and the child welfare area. And he really posed, the question to us about how we could embrace a more upstream approach, a prevention approach. And to be honest, at least from my perspective, we kind of like struggled with it at first as child welfare directors, right? We're like, well, wait a minute. Our systems are designed to respond. We react, right? When we get a call to the hotline or law enforcement calls out. And that's what we do. And most systems that we work with, like behavioral health, probation, education, right? They are systems based on mandates because of critical community needs. But I think as we all kind of just kept talking through it, we all recognize that we have high caseloads. We have young people in our foster care system now that have such an array of complex needs. We know we need more help from our community-based partners. And so maybe this was a time to really look further upstream, not really knowing what that looked like but knowing that that is something we needed to do. And I think it was such a pivotal point on helping us to continue to have this discussion around prevention, what it means, what the role is of the Child Welfare Agency, as well as our cross-system partners, our community members, our training academies, right? This requires such a comprehensive cross-sector approach. So, what Sacramento County did was really took advantage of this statewide movement and discussion on prevention. And Stuart referenced yesterday the first summit, which is a picture of which you see on the slide, that was held in January of 2019 down in San Diego. And I think there were 33 applicants, counties that applied, and the state CWDA strategies were looking for teams of 10 from each county with cross sectors at the table, decision makers. And we were fortunate to be selected as one of the counties. And that really was the launch of our effort here locally. We came back, we added a few more partners, and Sheila will go into it shortly about who we've involved, but is a really strong cross-sector approach with leadership that is committed to this journey. And we've been working ever since. We continue to meet monthly, disrupted a little bit early on by the pandemic. But Sheila will also talk about a Department of Justice grant that we got that really kind of helped us focus. Because to be honest, as we launched this prevention work and this cabinet, we kind of struggled a little bit to see, okay, where are we going? What are we doing with this? And so the Department of Justice grant helped us to get focused. And now with the FFPSA, we have a little more focus. With AB 2083, we have some more focus. So that's how we got to where we are today. And I'll kick it back to Sheila.
As Michelle had mentioned, we were very fortunate that we were able to get a grant from the Department of Justice. Sacramento County is one of 5 sites in the nation. It was one of those grants that is by the pound in terms of getting the access. But we were very pleased about that because it gave us some funding to support our staff in terms of doing the backbone supports and services. And very importantly, it opened the door to access to lots of very prominent consultants in a whole array of areas related to this work who have been very helpful to us. The goal of the Department of Justice grant is to reduce child abuse fatalities and near fatalities. And while that's not the be all end all of everything that the Prevention Cabinet has been working on, it is very much aligned with that. And so it has been a great blessing to have now 3 years of funding to support our work with this. And I have to acknowledge that trying to do that without any other support is a heavy load and a real commitment. And so I think that's, you know, something that we really respect in all of our colleague counties who are doing this work. This is a diagram of our membership of our cabinet. And we have currently 27 individuals who are members of 19 different agencies. And you can see, looking around the wheel, if you will, the categories that they fall into. We've got judicial system, law enforcement, probation, investors, including First Five, case and family programs, and others, healthcare, education, health services, child abuse and neglect service providers, child welfare, and then other community groups like family resource centers being represented as well. We have 4 committees: data, systems, community engagement, and then we have our backbone agency, and that's the CAPC. Although quite frankly, it's a joint backbone with child welfare, and so we do have those systems in place, and it's been really helpful to have the support of the staff to really keep all the committees going, as well as the whole cabinet. What you see in the middle of this diagram, however, is what's critically important, and that's the parent, youth, and family voice. And we're going to talk a little bit more about that in detail in terms of how we really incorporated that into the cabinet. I do want to mention that we also started with an evaluator right away, so that we had that support of helping us with our data, with our theory of change, and with other elements of this, as well as keeping track of our progress. Importantly, they also do something that I think is very helpful in maintaining the stability of the cabinet, and that is that they do a survey every year that includes all the members of the cabinet, and I don't know what everybody says, but they give us all back the results, so we see how we're doing and what the temperature is of the cabinet itself, and that's been really helpful in that sustainability part. We collected and looked at so much data that we could spend a whole day showing you all this data, and you don't want us to do that. But we were very fortunate that we had over 20 years of child death data from that team, and we had the access to all the near fatalities, the critical ones that were in child welfare. And so we were able to look at a 10-year period of time from 2009 to 2018, taking all that data collectively together. And what we saw was that there were 140 children who had been victims of child abuse, fatalities, or critical injuries. We saw that they were mainly younger children, about 80% of them, 50% of the total were infants. We saw that the parents were the primary perpetrators, and we saw that there was a pretty extensive child welfare connection. But we had a lot of additional information. And again, we were very fortunate because of the child death review team. We knew the locations, we knew where, we knew what communities where the deaths and the critical incidents had happened. We knew more about the characteristics. We knew if the parents had a background in child welfare, if a sibling had been in child welfare. We knew that that the families tended to be in poverty, and really the way we were looking at that is whether they had accessed benefits, and about 59% of them had. And likewise, we knew that 61% had had a substance abuse issue. So we were beginning to look at the risk factors. We knew the geography. We knew the characteristics of the children themselves. And then, of course, we also wanted to look at the disproportionality, because that has helped us focus, and really in 2 primary areas. One of them being looking at the age, that the youngest children were certainly the most vulnerable and the most at risk. And likewise, we looked at the race and ethnicity. And again, I want to be clear that this data is not today's data. This was through 2019. But when we look at that, you can see obviously where the greatest disproportionality is, and that is that African-American children were 40% of those who either died or experienced the critical injuries, and yet they're 11% of our child population. I do want to say, just in terms of data, that some things have changed and been going certainly better in the county since 2019. And the number of children going into foster care has been reduced substantially. And certainly Michelle can speak to that later. But we also have had some really important, very sophisticated quasi-experimental design studies looking at what our home visitation and our family resource centers have done. And we've had two of those, one with a control comparison and another one where we were looking at sort of time frame. And in both cases, we had really important outcomes. We saw that, for example, with African American children, what we have had is a decrease in the number of children dying, but really importantly, a decrease in the disproportionality, which has been very important. We've also seen, in terms of our home visitation, that as little as 8 hours has made a substantial difference in the likelihood of those families entering or re-entering child welfare. So we're happy to share some of those evaluations if people are interested. We have a lot of that data. And I think it's important when we're looking at data about understanding what's happening in our community, we also need to look at what's working and what's been making a difference. And we've been very fortunate, not only with our family resource centers, but again, one of the other recommendations from our child death review team resulted in the Black Child Legacy Campaign, which has been making significant differences in that population. So again, another plug for your child death review team. But you know, it's real hard for people to say no to those recommendations when they come from that kind of data. We basically did a halt somewhere along the way and said, you know what, we're doing all this analysis and so on. We don't have all the voices here that need to be here. We don't have the people with lived experience who are here at this table. And we've got to stop making decisions and moving forward until we rectify that. And so fortunately, our community engagement committee really took this on with a passion and did some really great work. They developed a matrix to make sure that we could really access the diversity of those with lived experience so that we could get a variety of voices like youth, parents whose children were in the system, so on, so that we could have some real clarity and really good information. We knew we wanted to recruit people and decided that no one would be turned away. You might not decide that you want to be on the cabinet and go to all the meetings, but there were other ways that people could be engaged in this process, whether helping with a focus group, whether maybe perhaps just being on one of the committees and so on. And this is not a one and done part of our process. This is an ongoing process to continue to increase the level of the voice of those with lived experience. So our wonderful committee also came up with an application process, and we used it far and wide. All the providers were sending it out to those that they have served. So did the agencies. Probation has a group of community advisors. First Five does. All of those people were given the access to these applications, and obviously that's available to any of you who want to use it. We also developed a role description, sort of like a job description, but what were going to be the elements of this. And importantly, it talked about certainly, what the timeframes are and the attendance and all those kinds of things. But really more importantly, it also had in it what the responsibilities were of the existing agencies who were on the cabinet and how they could be supportive of those coming in with lived experience. Next slide. So the good news is we did get some applications and some very, very good ones. They were de-identified. So in terms of just looking at the application, you didn't know who it was specifically. The committee then did have 30-minute interviews with people to talk about, what the work was and so on, and see what their particular interests were. And then there was a selection, and we do have committee. We do indeed now have not as many as we want yet, but we do have truly people who are committed and have that lived experience. Next slide. Importantly, we decided before we even did any recruitment, we were going to provide stipends. I get paid to be there. Michelle gets paid to be there. All of us from organizations are paid for our time, and we wanted to make sure that we did that in a fair and equitable way for our community representatives. We also assigned mentors to the new members, the community members, so they could get up to speed, so that if some of this, we got into jargon and unfortunately would maybe be doing acronyms, we could make sure that there was somebody there who was also supporting that member. They also have gotten some support from CAPC, and they've received an orientation and an onboarding so that they're really ready and are an equal voice, not an advisor. They are a member of the cabinet. So with that, I will turn it back to Michelle.
So based on the data that Sheila referenced earlier, the 10 years worth of data, the Prevention Cabinet established a pretty bold vision, which was to eliminate child abuse and neglect deaths and critical injuries by 2030. And we played with reduced by 70%, 80%, 90%. And we really wanted to have the bold vision of eliminating child abuse and neglect deaths and critical injuries entirely. Audacious, yes, but we think that if we really put together a strong strategic plan, we can get there as a community. Excuse me. Some of the data that we looked at was also about the economics of child abuse, which was put together by Safe and Sound. I believe they did it for every single county. So if you haven't seen your counties, I think it's really important to take a look, because it's great information to be able to use as part of the ongoing communication that's needed in order to really discuss prevention with different partners, and certainly with county board members in advocating for funding. So in 2020, there were 2,504 substantiated victims of child abuse and neglect in Sacramento County, and 2 child abuse and neglect fatalities. The cumulative impact to Sacramento County, fiscal impact for those victims, is $919 million. Pretty significant. And although these costs are accrued over the years in the course of the victim's life, they continue to incur the same cost each year until we're able to reduce and ultimately eliminate child abuse. So Safe and Sound does a great job of even breaking it down further. Excuse me, I got a little frog in my throat. So looking at the cost of child welfare, $197 million. And that's looking at the intervention services that child abuse victims will need, foster care payments alone, understanding some of our kids go to group homes with much higher costs, and the counseling services that are needed, reunification services that we pay for from the mental health and substance use perspective. Education, $40 million. We know that abused children are 77% more likely to have special education needs. Criminal justice, $20.7 million. We know kids that are involved in the child welfare system are 60% more likely to be arrested as juveniles and 28% more likely to have an adult criminal record. Lifetime productivity, victims are more likely to be unemployed and rely on public assistance, which leads to diminished earning income potential, $418 million. So you can see these costs cross systems and are significantly expensive within community. So when we talk about the importance of child abuse and neglect, this is really good information when you're trying to convey the fiscal impact. We also always want to convey the importance of child and family well-being, elimination of child abuse and neglect. But this also tells the fiscal side of it, and imagine the services that we could provide if we directed this money elsewhere. So with our vision locked in, we developed a theory of change, and we cringed when our evaluators started talking about theory of change. I think everyone's like, oh, theory of change, blah, blah, we don't need that. But it was really important, and we took the time that we needed to delve into it. And we developed our theory of change that outlines the foundational values that cross-cut all 4 strategies that will get us to our vision of eliminating child abuse and neglect deaths and critical injuries by 2030. And we worked hard on the values, the strategies, and lining it right into our vision of success. Excuse me, I'm really struggling here. The prevention cabinet, we started a needs assessment. Multiple folks that were contributing into this needs assessment to identify key strategy areas that we could use and implement to strengthen our prevention efforts as we built a system of care. So you can see our community, family, and voice, and we put down what we meant by that, right? Recognizing the need for the intentional and genuine engagement of community, parent, and youth voice. And Sheila talked to the process that we put in place, the mentors that we assigned, the onboarding of them. We also understood that you can't have just one voice at the table. It's important to have an array of voices. It's important to really help them understand the process. The last thing we want to do is have someone on the cabinet just to check the box, right? See, we had community at the table. It's really important to help folks understand, to onboard them, to get to that meaningful engagement. We developed racial equity strategies, trauma-informed systems and practices, and the building and implementing a system of care. And this part is really important. I think, many counties are involved in the AB 2083 work, and Sacramento County, which again, I just love this county. Our interagency leadership team from the beginning pushed to include our prevention partners as part of our system of care work, because we knew that you couldn't have a strong child and family system of care without having primary prevention at the forefront, right? That's got to be the beginning of the continuum. And then secondary, tertiary prevention strategies scattered across the continuum, all the way into aftercare services. And so we have our first 5 partners at the table. We also invited our Department of Human Assistance, which are our self-sufficiency, because we wanted to ensure that we were addressing benefits, addressing concrete economic needs of our families. Again, we all know like roughly 60% of our families are involved because of neglect. So really looking upstream, addressing the social determinants of health as part of that system of care. On our prevention cabinet, we have a standing agenda item of an AB 2083 update. And then also on the AB 2083, we provide prevention cabinet updates. One of the things we're discussing right now is how we use our prevention cabinet as a form of governance structure for our FFPSA work. We've done so much work as part of our prevention cabinet that's going to help inform our FFPSA community prevention plan. We have more work to do, but there's so much that we can draw from. And so we really want to use that as a primary body to help lead forward our planning. The other thing we did with our AB 2083 is we invited the juvenile court to be involved. So actually our presiding judge and I are the co-chairs of our interagency leadership team, because we really want our courts to be aligned. And we have a great presiding judge who's now getting more seeped into the prevention aspects, which is also going to be critical for our community. So after establishing the strategy areas, we started to create and then refine activities and correlating actions to each of those activities. And we just wanted to highlight a couple of the areas. So looking at racial equity, and again, we have such a strong evaluation team, and they just guided us through this process. And I'm telling you, there were times it was tedious. I wanted to pull my eyelashes out, but it really helped us stay focused on what it is we were trying to accomplish. So promote and support family serving organizations to conduct organizational assessments of equity policy and practices. So part of what we want to do as a team is identify and share best practice tools and resources for organizational self-assessment, cross-training, use of surveys and consultants. In our child welfare, we engaged gosh, I just spaced on his name, but doing implicit bias training, and Dr. Bryant at a Morehouse. And we invited we started at leadership, and we had 2 4-hour sessions just for leaders. And we invited leadership from CAPC, from probation, from child welfare, behavioral health, community-based partners, public health, gosh, so many different, district attorney's office. Our county executive actually participated as well. So kind of doing this shared learning, because we know that you can't just shift one system. Our families tend to touch many systems. And so we are all really committed to doing that cross-sector work. The trauma-informed systems and practices, one of the actions that we identified, the 3.2.1, reviewing policies, procedures, training, and practices within and across systems and agencies with trauma-informed lens. Our partners over at our Sacramento County Office of Education is doing amazing work, leading community work on our ACEs. And so really leveraging what it is that they're doing within there, but we have many representatives from all the systems that are also involved in that work, which just strengthens that trauma-informed lens, again, across the systems. We're also lucky because, and we need to do a refresh training, but we have a court that went through trauma-informed training. And again, I think we need to do a refresher, but just having that openness from the bench is so critical as we work to reduce trauma just in the courts alone. One of the things that our evaluators did was using the Mentimeter, which is so cool because it's all live and we get to see everyone's thoughts playing out. So once the actions and activities were established, we moved to prioritize in order to begin like kind of 6-month increment, 6-month action plans. And so we also looked at what was achievable in the short term and what we thought we were most ready for. So it's not just let's go do it, but what is our readiness around each of these activities? So cross-training staff to increase understanding of trauma, reviewing the policies and procedures for trauma-informed, identify best practices to address secondary, right? So you can see all of them and you can see whether folks thought we were very likely or not likely. And so from there, you could see where the priorities were. So our first launch will be focused on reviewing the policies, training and practices with the trauma-informed lens and making recommendations to reduce further trauma. I think to some degree, many agencies involved in this work are already doing it. It's really good. I think everyone is really shifting to that, if they haven't already, really shifting to that trauma-informed, but understanding that it has to be an ongoing effort to understand the different areas, the different touch points where we unintentionally induce more trauma and how we can lessen it. And again, it's got to happen cross systems. If child welfare goes in and does nothing around trauma-informed, but behavioral health does and probation, it's not going to help if that child is involved in the child welfare system, right? We all have to be swimming in the same direction, rowing in the same direction. So this is kind of how we laid out every single activity. Oh, that's fine. Go ahead and go forward. So, so just to close out, I think what's really important, first of all, I'll say this has not been a smooth journey. I kind of relate to it more as a hike. And it is going back and forth. And I don't know if some of you out there who like to hike use those apps and they rate the hikes as easy and moderate and hard. And I was on one recently that said it was easy, and I was cussing at the app the whole time because it was not easy, right? And I thought prevention, I'm all jazzed about it. This is going to be easy. It's not been easy. It has been fun, but it's not easy. And it's something that we have to keep pushing through and working together to get there. I think everyone's still reimagining and envisioning how child welfare embraces prevention, primary, out in the community, supporting and sustaining that work. The communication piece is critical. This Sheila every year is so great about getting before our board, and we partner on recognizing Child Abuse Prevention Month. And we use that opportunity every year to message something. And the last few presentations that we've had before our board, 3 this year now, have all focused on the importance of prevention work. And so again, as Sheila talked about, using the data, that's so important to communicating the message, using the information on the economic impact that Safe and Sound put together. Also understanding cost to other systems. We did a huge ask in our budget this year to support prevention work. We're using it right now, all our realignment, local general fund dollars that our board is supporting, because we were able to show, right, over the last 6 years, we have reduced the number of kids in foster care by 5% each year, which is pretty amazing. We reduced entries by 58%. If we can reduce by another 5% in 1 year, we save foster care payments alone $1.5 million. And that doesn't include group home care. That's just a basic foster care rate. Doesn't include the social work costs, all the other service costs. So understanding your data and using it to message, depending on the audience, is really important. And then a few people have talked about sustainability, and that's going to be the critical piece. This prevention work cannot be one and done, or we've got this great prevention program, they're going to do it all. I think the blending and braiding of funding is critical. And I know Franny mentioned a couple of the funding streams. Locally, we use CalWorks dollars for some of our home visitation, First 5, local county general fund, realignment. We can use MHSA money, education money. Sheila's done great with leveraging AmeriCorps funding to get more family voice and involvement, right? So there's such an array of resources that we can use, but we cannot be dependent upon 1 or 2 funding streams. There's got to be that cross systems approach. And I think that's one of the things that I'll just say is really to consider how you can integrate this work and your AB 2083 system of care work, and how you can ensure you continue to get partners at the table. I loved looking at who's on the webinar today. So I just took a few. We've got public health, we've got CAPCs, we've got probation, plus their statewide organization, CPOC. We've got community partners, First 5, regional training academies, researchers, evaluation teams, education, behavioral health. We've got parent partners, and then we've got our prevention partners. And that we need that wide array of partners in order to do this work and in order to really promote child and family well-being. So Sheila, anything else to add?
Thank you so much, Sheila and Michelle, for sharing this amazing, planning process and just all the work you've done. I know there were some folks who had some questions about your community advocates, the community representatives.
In regards to the community members and the people with lived experience, one of the things that we've struggled with in LA is to figure out the best way to be able to ensure that they are compensated. Did you run into any issues with that? We've talked with our county council. The procurement process seemed pretty rigorous, and providing funds outside of that through contracts, there was issues about a gift of county funds. So I wanted to know, how did you kind of overcome that if that was an obstacle?
It was not an obstacle at all. We decided from the very beginning that that's what we needed to do, and we did have some additional resources because we had the grant, so that was helpful. So we really didn't have any sort of administrative blockage or anything. It was really pretty straightforward.
And it's a great question, Corey, from a county system. Because it has been difficult for us to do it, which is why we use our partner organization to do it. We use gift cards with our FIPPERS funding, right, to be able to support families early on, to be able to take kids right into care, particularly relatives. It is an arduous process to be able to get to it, but I wish there was more flexibility. When I was in the mental health space, it was specifically designated that MHSA funding could be used for stipends, and that was really helpful. It would be great if the state could move towards some flexible funding that would specifically allow for child and family involvement. As Sheila said, we're all paid to be at the table. And if we truly believe children, youth, families have lived expertise, in my opinion, they ought to be paid for that expertise in helping us shape a stronger community safety network and contributing to our work.
And I think that's a good point in general. One of the great things about being in partnership with your public and private agencies is, the private ones can say things that maybe everybody would like said sometimes, and can also be more flexible in things like the stipend. So, work together on those things.
Great. And then
Yeah.
sorry, Sheila. I know that Jasmine Brosnan, who's part of the team, has added in some, I think, helpful links just about the information that some folks were asking. And also Stephanie and Elizabeth were just sharing some funding opportunities for these types of things, like the ARPA CB CAP funds. Stephanie mentioned that they have a Department of Justice grant that helped paid for that. But I think that's a wonderful reminder that if we ask community to come to the table, that we are compensating them for their time. So I think that's great. There's one more question about if you're seeing a difference between how your system is perceived by the community and, like partners, organizations, families, et cetera, to assist families to accept support.
I would say yes. And I think it's a combination of factors. I think it is having so many people at the table. I think also promoting just even cross systems and understanding of what we do, what we have the authority to do, what we are mandated to do, and what we are not able to do. That alone, I think, has helped strengthen relationship just with other partners. But I think having community at the table, it's kind of this cross-sector approach, utilizing we have 9 family resource centers. We get borrowed credibility through them, right? They're trusted, and they can be kind of a liaison to our agency. We also have a really good cultural broker program where we use African-American community members to serve as cultural brokers with our community. That has that has significantly shifted perception, particularly of African-American communities toward our agency, which is not something that historically has been the case. And we have obviously far more work to do. And I think that it's the continued community involvement, community engagement, listening and implementing some of their strategies, sharing that power. I think that is the only way we're going to be able to shift perception from our community, particularly our communities of color.
Hi, this is Lola Cornish. I'm with Strategies TA, and I have the honor and privilege of announcing Paul Collier, who is going to be presenting on the data playbook. And I have to say, in this prevention space, gears have been turning independently for a long time, and it's beautiful to see them finally coming together into what we hope will become a seamless system. And data is certainly a huge piece of that. So I'll let you take it away, Paul.
Thank you so much for the introduction, Lola. I appreciate it. And also you were one of the most helpful people in drafting this whole thing. So very appropriate that you introduced me here. So super excited to be with everybody today. We're talking about the Data Playbook for Prevention Action Planning. This is a new resource that's been developed with partnership from many folks around the state, including OCAP, to really help prevention planning teams make the most out of data as part of their planning process. So the objective for this today is I wanted to give you an overview of what exactly is in here. You know, this is a pretty dense resource. And for those of you who are never going to have the opportunity to read this, I want to give you the key points about the data playbook and also give you a taste for what is in here so that if you do dive in and explore it in more depth, you know what to expect. So what are we going to do today? We'll start with some background. Who am I? Why was Safe and Sound involved in this process? And sort of touch base on why the data playbook is so important. Then we'll really spend most of our time jumping through some of the big ideas from the data playbook. And we've got 3 chapters in this resource. The first is around planning for success with using data. The second is engaging your community with data. And the third is around telling your story. And then we'll talk about next steps, where to find this, how to get some additional help. Next slide, please. So first, I'd love to hear from you, and I'm going to try and make this interactive. So Kathy, please launch this poll. I'm curious, so who in your prevention planning team is responsible for finding relevant community data? And just select the answer that makes the most sense. You should see the poll on your screen right now, and you can select one of these options. It could be one person in your team, maybe it's a consultant, maybe it's a subcommittee of your team, maybe everybody, or maybe nobody. So just take a second here, give me a response, and we'll leave this open for maybe another 10 seconds or so. Just kind of curious where everybody's at. Okay. Kathy, let's kind of close this and see where folks are at here. I'm actually really curious myself. Hopefully this will show us. Okay, wow, what a distribution, huh? It looks like the responses cluster around a subcommittee of our planning team or all members of your planning team. So we're going to talk quite a bit about how to find relevant community data here. So if you are that subcommittee member, definitely pay attention, or if you're one of those teams where everybody is responsible for finding data, definitely pay attention to the first half of this, because I think that this should really speak to either what you've already experienced or what you soon will experience as part of your planning process. Awesome. Next slide, please. So who am I and why is Safe and Sound involved in this? Safe and Sound is a community-based organization based in San Francisco. We've been around for almost 50 years. And the bulk of Safe and Sound's work is directly working with families, parents, caregivers, and children through our Family Resource Center, which is located in the city of San Francisco. In addition to that direct service work, we also serve as the Child Abuse Prevention Center for San Francisco and Marin counties, and we operate the San Francisco Children's Advocacy Center. So we have a role to play in educating, collaborating, and advocating for child abuse prevention in San Francisco and the greater Bay Area. I was on the team for several years as our internal data and evaluation manager. And then when I left the team full time and I became a consultant, the Safe and Sound team asked me to serve as the project manager for this Economics of Abuse project. And Michelle, you guys did an awesome job selling the Economics of Abuse tool. It's available for everybody, and hopefully everybody now knows where to find it. I'll touch on it in a second, but that was really the introduction to us being involved in creating tools to help communities really use data to make the case for investing in prevention. So, long story short, one thing led to another, and OCAP asked us to partner with them in helping create this data playbook tool to support counties in really integrating data into their prevention planning processes. Next slide. So, here's that cost calculator, and Michelle, you guys sold this. I'm not going to tell you too much more, but do go check it out. It's economics.safeandsound.org. You can enter your county in there. I have been deeply involved in this, and I can tell you that we have the most up-to-date data through 2021 on that site. So you can figure out what's an estimate of the economic impact of child maltreatment for last year on this website, and use this as part of your advocacy efforts. Next slide, please. Okay, so we're talking about this new tool, which you can also find on that same website, this data playbook for prevention action planning. And I'm really excited because as the prior speakers have talked about, using data is an integral part of how do you create a prevention plan that really meets your community's needs. So wanted to just share a little bit about how we got to this process. If you go to the next slide, we can talk about who are our partners in developing this. So Safe and Sound, we've gotten experience doing this planning process, but we really approach this as a peer. There are a lot of folks that we wanted to get involvement from and input from in designing this resource. So one of the first things that we did was we talked with 10 different prevention planning teams from around the state who have each done something really, really unique and valuable in terms of using data. So we talked with folks from Contra Costa County, Kern County, Lake, Marin, San Diego, Ventura, San Francisco, San Luis Obispo, Santa Cruz, and Shasta counties. And they gave us some really helpful input that informed what we decided to put into the data playbook. In addition, OCAP helped connect us to several other individuals and organizations that have a stake and provided really helpful feedback on the drafts. So folks involved in the drafting process represented California's Child Welfare and Learning and Evaluation Bureau, our Department of Public Health, of course, the Office of Child Abuse Prevention, Casey Family Programs, Strategies, TA, Lola, and Sarah were hugely helpful. The California Child and Family Enrichment Cabinet and Ventura County's Prevention Planning Team actually served as test reviewers for this tool. So it was truly a team effort, and I can only take so much credit for this, but I get to be the messenger. So lucky me. Thank you so much for all the folks that have played a role in this process so far. So let's just talk a little bit about why this matters. What I want to mention here is that we're not talking about data for data's sake. What we're trying to do is create really effective prevention plans that serve our communities well. And so David Swanson Hollinger said this better than I can myself. He said, I think it's about helping families before it gets to child welfare. We need leadership from system, public partners, private agencies, and the community to support and strengthen our families. So again, we're talking about data used for prevention planning, but data isn't the end game. Effective strategies that support our communities are the end game here. Next slide. Roger DeLeon from Riverside also shared, I think, a really important point. He said, it's important and respectful to understand the challenges parents face. By collecting community level data, county planning efforts will have a better chance at helping families be safe and stay together. So throughout this, even though we're talking about some maybe wonky, some technical stuff, I'm trying to keep in mind, and I urge you to keep in mind, we're trying to be respectful to our communities by truly understanding the challenges that parents and families face. So that's where we're coming from in this whole conversation. So what's in the data playbook? It's organized in these 3 sections. So really the first chapter is what you see in purple here. And this is planning for success. These are things that your prevention planning team can do to engage with data on your own before engaging community members to collect additional data or around that data. So we'll talk through several of those steps. And I'm guessing that many of your teams have already done at least some of these. The green sections here, chapter 2, represents ways that you can engage your community with data. And so that can look like asking for feedback. It can also look like engaging community members in analyzing, helping you make sense of their input. And then the third and final section focuses on communication. So how do you present data in an engaging way and use it to help tell your prevention planning story? So we'll touch on that a little bit here at the end. Next slide, please. So as I mentioned, chapter 1, we're going to be diving into how some things that we can do to really plan for using data well. And so this chapter includes the following sections. So the first is making the case for using data in prevention planning. And I actually think that Michelle, Sheila, Freeney have made the case already. So I'm not going to spend too much time on this topic here. We'll jump right into the second section, which is how do you help your prevention planning team members really build the necessary data leadership skills to engage with whatever community data that you have. The third section goes into selecting a framework that helps you really narrow in and organize the data that you want to look at. And then the fourth and fifth sections explore how do we find existing community data. So we'll talk about each of those in turn. Next slide, please. So in terms of important data leadership skills, one of the concepts that we think is pretty foundational to this is understanding the difference between using data for planning purposes and data for adapting something already going on. And both are really valid. Your prevention planning team may explore both, but conceptually, if you're using data to plan something new or to plan a new intervention, you're looking at information about the problem, your community context, and potential solutions that you might be able to use to solve problems or challenges in your community. So this is the sort of general data use that we're talking about here. Let's contrast that with using data for adaptation. And one of the most common sort of scenarios of data use like this is in program evaluation. So when we're doing a program evaluation, we're collecting data on implementation. Are we doing our work with fidelity? We're collecting data on the consequences of our program. What are the positive results? What are the negative results? And ultimately on the impact, both individual outcomes and changes at the community level. That kind of data use is super important. And we'll use some of that data too, potentially as we're informing our next steps. But between these two purposes of using data, the data playbook focuses more on data for planning purposes. So I wanted to share that because you might think there are a lot of other concepts that are important to evaluation that you don't see in here. And that's true. That's a conscious decision for us to really focus on how do we use data to make a good plan, to choose solutions or choose ways to expand solutions in our communities. So some of the other data leadership skills that we think are really important for folks. Prevention planning team members should have or develop skills for integrating data into decisions. So knowing when to ask for data and knowing to just ask that question. What does the data say when we're making an important choice? That's an important skill, a baseline for folks to have. And then some skills around interpreting data products. So understanding where does this data come from? Can I trust the source? What can I learn from it? How can I use this, or how can we use this to make an effective prevention plan? Those are some basic behaviors, some basic habits, if you will, that I think we hope that all prevention planning team members either have or are able to build throughout this planning process. And then some things to just be aware of. I think it's important for prevention planning team members to know the different kinds of data used. We've mentioned data for planning versus adaptation. It's also important to understand why data quality is so important. Ultimately, if you have high quality data, it contributes to information that is sort of data placed in context, to knowledge, data placed in context that can be applied, and to wisdom. So, all of that taken in line with your team's values and your team's objectives. So data quality is sort of the fundamental asset to really making important, meaningful, wise decisions with data. And then finally, just being aware of common biases. Everybody has a certain kind of bias. And so just an awareness of common biases in interpreting data, like confirmation bias, selection bias, positionality, that is the history that we bring to data. That is super helpful in allowing us to really foster processes that help us make good decisions, because then we can think, how do we design a process of engaging with data that avoids some of these biases? So those are some of the key data leadership skills. We go into a lot more depth in the data playbook, but want to just provide a summary of some of these things here for you all to understand and use as a foundation. Let's go to the next slide here. One of the less obvious, recommendations that came out of our process of engaging counties in talking about data was the importance of having a data framework. So if data framework is just, a way of organizing the many kinds of community data that you could be looking at. And there are 4 examples that we look at here in the data playbook. So we explore the social determinants of health, the 5 protective factors, the Strengthening Families 5 Protective Factors framework, the Building Community Resilience model, and the Adverse Community Experiences and Resilience framework. So there are these 4 options, and each have pros and cons. None is wrong. Some might be right in certain circumstances. But choosing a data framework can really be helpful in defining the scope of the community data that you want to look at. And it helps you communicate what data you're looking at, because certain frameworks resonate with certain audiences. And so it can be very helpful from a communication standpoint to pick a data framework before you start pulling metrics and looking at a wide array of community data. So to make this, I think, a little bit more practical, a little bit more applied, let's kind of talk through an example. So let's go to the next slide. If we imagine that we picked the Adverse Community Experiences and Resilience framework, so that's our data framework. So this framework essentially argues that there are 3 important aspects to understand in a community that help us help us avoid adverse community experiences and build communities where families have everything that they need to be resilient. So those 3 aspects are equitable access to opportunity, the people environment, and the place-based environment. And so if we use that framework to organize our data to help us look at community data, if we start with the equitable opportunity aspect of this, some of the data points we might look at. We might look at households under 20% of poverty. We might look at unemployment rates, rates of savings and wealth building, business investment trends, and maybe perceptions of opportunity. So things to kind of just keep in mind as we're looking at these, regardless of the framework, you want to look at indicators of both community assets or strengths, as well as community challenges. Both sides of that equation are important, and many data sources will focus more on sides of community weakness than community strength. It's also important to understand not just sort of procedurally collected data, but individual perceptions. What are people's perceptions about this area? Because that might differ than some of the other data points. So let's talk through the other 2 quickly. So if we go to the next aspect, people, some data points about the sort of people environment could include family composition, access to healthcare, child maltreatment rates, perceptions of trust and agency, social norms and any common narratives that are seen among families in our community, and any sense of culture or shared identity that's happening in our county. And then finally, for place, some of the aspects here could include housing availability, home ownership rates, quality of public spaces, crime rates, and perceptions of safety. So hopefully this helps you sort of see, okay, a data framework can really help us zoom in and narrow onto particular aspects of the data that we ought to be looking at. It makes our job a little bit easier. It makes it more possible for us to look at data points that really describe important aspects about our community. Go on to the next slide. So I'm curious now, let's have us all just kind of type in the chat. What data sources have you or your prevention team found valuable in exploring your community so far? And if you haven't looked at any data sources, you don't need to respond, but if you have, or if you've got one that you really love, I would love to just see that in the chat right now so that we can see what data sources other folks have actually used. Awesome, Clarissa, I'm seeing kids data. You'll see that here in a second. Anybody else have one that they've used and they really like? Thanks, Lisa. Yep, local offer C data, the Child Welfare Indicators Project, Safe Measures, absolutely. Casey, yep, Children Now. Thank you, Lola. Okay, y'all are stealing my thunder here, because there are most of these sources actually are sources that we include in the data playbook. I'm seeing the racial equity access. Elizabeth, you mentioned that one. That one isn't in there, but it sounds like a really good resource. So feel free to keep these coming, because I think we can all learn from each other. We're all new-ish in this planning process. So I want to just make the point, this data playbook is not the end-all be-all resource, but we are hopeful it is a really good starting point. So let's go to the next slide here. We wanted to give folks a top 10 list of existing sources for community data. And these aren't your only sources, but maybe these can be some of the sources you go to first if you haven't explored community data yet. And many of the things that folks have mentioned here are on this list. Like Judy, you mentioned the opportunity map. Casey Opportunity Map, I think, is actually maybe the first source that we would suggest folks go to, because it is pretty easy to use, and it has data on education, housing, family well-being, and accessibility. So it covers a lot of ground in a way that's pretty user-friendly. So I think, we kind of list this in potential order of utility. So next is the Prosperity Now scorecard. Exactly. The source, this is a really great source for family income and asset information, so economic information. Among census data, these narrative profiles from the American Community Survey are probably the most user-friendly of the census's data sources, and they provide pretty comprehensive community demographics. Kids data is another great source. The superpower of kids data from our point of view is they're kid-specific indicators around school safety, childcare, child behavioral health. They have some unique data points that several of these others don't. The Strong Start Index is a very interesting one. It really is one summary metric that can be compared neighborhood by neighborhood. And so I'll show you a screenshot of that here in a bit just to see how valuable that is. Let's go to the next slide. So the number 6 resource on this list is the Children Now County Scorecard. That's really great comparing one county to another. They've got some super user-friendly visualizations. The California Child Welfare Indicators Project is sort of the go-to, or at least my go-to, for up-to-date statewide child welfare system data and child maltreatment data. So the Economics of Abuse interactive website, the Safe and Sounds project for the last several years, really focuses on quantifying the impacts of child maltreatment in your county. And the Sacramento team did a great job illustrating how they've been able to use that to talk about how costly this issue is for their region. A couple more to mention. The California Health and Human Services Department has these county health status profiles. They have some unique information around health, particularly maternal health care, that can't be found in some of the others. And then last but not least, this last source, Policy Map, is a really comprehensive national data source that you can really use to zoom into counties, cities, zip codes, even census tracts. So if you can't find a data point elsewhere, you can potentially find it there. It's a little bit more complicated than some of the other resources. And so I wouldn't say go there first, but definitely go there if you're having a hard time finding some other data points. Okay, so we've talked about how do you access some existing data? How do you plan for engaging with data well? Let's go to the next slide. So now many counties find it helpful to engage with their community in some way. And the reality is everybody's doing this. We've already talked about many ways of engaging the voice of community members with lived experience of adverse community situations in your planning process. So here are some ways of doing that. Let's go to the next slide. If you have a data framework, you're collecting and aggregating existing data, you'll probably find there are some gaps, and you'll probably want to collect some new feedback from your community. Before doing so, just consider, keep in mind the following risks. So I think the first is representativeness. It's so hard to get representative community data, and that doesn't mean you shouldn't do it. You just need to keep in mind who is included and who's excluded in reviewing any community information. There are always going to be some people who can't participate in whatever method you have. And just being mindful about that perspective as well is important when really making sense of whatever data you're able to collect. That leads us to the second point, accessibility. So you want to make it really easy for your community members to engage with you. So having multiple ways to provide feedback and not just one approach helps with accessibility. And there's a whole list of other accessibility considerations related to language, related to timing and place. The data playbook goes into that in more depth. The third is fatigue. It's important to understand who's already asked your community for input. Try and leverage some of that existing data from other folks who have asked families about what they're hoping for, what their dreams are, before you go and collect your own. And then the final is trust. You should be considering working through an organization that's a trusted entity. I know that Michelle and Sheila, the Sacramento team, said, we work through some of our local family resource centers, we inherit their trust. You want to think about collecting data through entities that have that community trust, because you'll get better engagement. You also want to make sure that you are using somebody's data trustfully, or in a way that is trustworthy. So if you're collecting feedback, make decisions with that feedback in mind, and tell your community how that feedback informed choices that were made going forward. So let's go to the next slide. The data playbook outlines several different ways of collecting new information from your community. And most of these are not rocket science and probably aren't new to you. What we do in the data playbook is really discuss some of the strengths and limitations of each of these, as well as where to go to find a very practical sort of how-to for these. So we've tried to link a resource for each one of these data collection methods that spells out how do you go about, for example, conducting a good survey, hosting an effective community meeting. How do you go about doing a thorough asset mapping process? So it is your choice which combination of these approaches you use, but we've tried to really be clear what are some of the strengths and what are some of the challenges of each of these so that you can make intentional choices. Okay, so we've talked about collecting some data anew. Let's go to the next slide. I'm personally curious again, so this will be a poll, and Kathy, please help me out with this. We're curious who in your prevention planning team is responsible for reviewing relevant community data. So you've collected some data. Who's responsible for actually looking at that data and figuring out, okay, what do we do with this? Select one of these that's the best option for your county. You can choose one option for our one member of your planning team, a consultant, a subcommittee, all members of our planning team, nobody, maybe even somebody else. So just let us know, who's responsible for reviewing relevant community data. So I'll give you another couple seconds to respond here. And while I do, thank you, by the way, for everybody, including Rochelle, for sharing some of these additional resources in terms of where to find data. There's a lot of county and region specific resources out there that we don't have in the data playbook, but you all should check out. Okay, let's close that poll and let's see where folks are landing here in terms of reviewing data. So this is awesome. 49% of folks said all members of our planning team are responsible for reviewing community data. And that's great, because ultimately reviewing data is a team process. And that brings us into the next point here. So let's go to the next slide. And when we're thinking about analyzing community data, we have a few considerations. We want to make sure that the right folks are involved. And so it sounds like for most of our planning teams, there are multiple people. When you're thinking about doing this analysis process, you want to think about disaggregating your community data in appropriate ways. Why do we disaggregate? So disaggregating is sort of pulling together group data into relevant subgroups. We disaggregate because we're hoping to understand what disproportionalities exist. Where are there some groups that are greatly advantaged and some groups that are greatly disadvantaged in particular areas? So, so your steps in terms of disaggregating data, I think the first step is just you should do it and figure out how best to do it. But if we're to break this down, I think first you want to prioritize what are the subgroups that we really believe experience our community quite differently. And this might vary a little bit county to county. Some counties just have different demographics and different makeups than others. And so you'll want to consider things like race and ethnicity, age, sex, gender, location, immigration, disability, and or tribal status. And the reality is most all of these things are important, and they might be relatively more or less important for certain counties. So you want to prioritize that. What subgroups do we really want to look at? And then you want to assess, based on the data that we have and the data that we've collected, what ways of disaggregation are possible. Several of the existing data tools, including the 10 I shared before, allow you to disaggregate by at least some of these, but most of them don't allow for all of them. And so just looking at what's possible, I think, helps narrow things down. So then go about disaggregating your data. Have one person or an individual in your planning team break apart these overall metrics into smaller groups and see if there are any disproportionalities in these community conditions for one group versus another. If it's possible, the best practice is to look at multiple dimensions together. We know that a person's identity is not a factor of only one aspect of diversity. It's a factor of multiple. And so looking at the intersections of different kinds of diversity, different kinds of subgroups can be helpful if that's possible with your data. And then finally, review this. You want to really summarize and visualize your disaggregated data in a way that the rest of your team can understand. So the data playbook has some suggestions on how to visualize disaggregated data, and it has some additional resources on how to do each of these steps. So it's one aspect you want to think about in analysis. A second aspect is looking by geography. So we'll go to the next slide. We're big advocates, and we heard from many of the counties we talked to that mapping their data was one of the most useful parts of making sense of their information. Maps are just intuitive. They help you connect, kind of theoretical ideas to a really tangible place that we can go to, we can see, and we can imagine in our minds. So you want to consider here, what level of geography makes sense. And you probably want to go deeper than your county as a whole, but do you look at data based on different cities? Do you look at it based on different school districts? Zip codes are even more granular, and then census tracts are the most granular way of looking at our data generally. Again, it kind of depends on your location, how your county's set up, which of these makes sense. Many of the data tools that we shared previously allow you to map your data. So the KC Opportunity Map was one, that is a map. Another is the Strong Start Index. And so here's actually a screenshot from the index. This is zoomed into the particular census tract that I lived in when I was living in California in Berkeley. And you can see it's an area, the census tract is maybe 4 blocks by 6 blocks. It's very small. So we can zoom into a really particular area with this tool and understand almost by neighborhood how community conditions for young children differ. So that's an example. The data playbook also has some different suggestions. If the data source you have isn't a map, how do you go about mapping your data? What are some technologies that are fairly easy to use that allow you to see your community data in a map? So, so more of those in the actual playbook. So let's go to the next slide here. I mentioned before that data analysis is really something that is best done as a group. And I kind of use the term analysis is a team sport. You want to engage many individuals in making sense of what your data says, of determining the narrative that we're seeing in the data. And we think it's really critically important that we are engaging community members with lived experience of any of these adverse conditions we're looking at in the process of helping us understand what is the data telling us. We've heard before this session today of several great examples, having individuals involved in subcommittees, getting community liaisons involved. One approach that we suggest in the data playbook is hosting a community data party, quote unquote. And this is essentially a one-time event, something that engages community members around a particular piece of data and allows them to tell you, what is this meaning for them? So in the data playbook, we outline a process for exploring this. It really starts with figuring out what are the objectives of engaging our community, going through the right channels to invite community members, preparing our data for review so that it's accessible to the folks that are going to be involved. And then the day of or the evening of, giving people time to engage with that data, providing ample space to just discuss reactions, questions, start brainstorming implications among your group, and then having a process at the end of this to really follow up with folks, let them know how their input was used and is informing your plan going forward. So definitely encourage you, no matter what way you choose, to engage community members in helping you review and analyze data before you have come up with the story or the narrative of what your data is telling you. Okay, let's go to the next section here. We've gotten almost all of the way through the data playbook. We have just one more section to talk about, and this is the section around communicating your data, presenting it in ways that are engaging to your broader community. So let's dive into this. Go to the next slide. I think I've got a question for everybody. So I'm curious now, one last and final poll, bear with me, please. How would you rate your planning team's ability to communicate effectively with data? And just answer honestly, answer right now. Do you think that that's very low? Do we think it's moderate? Do we think it's very high? And I know from these presentations, some of y'all have done and are doing some really, really awesome work on this. So I wouldn't be surprised if this is high for some. Let's close this poll. Let's see where everybody's at here. Oh, great. Look at this. We've got a good distribution. So 8% very low, 23% low, 48% moderate, 17% high, 3% very high. And I'm not surprised in this. I think that we're in this work not because we're data communications experts, but we need to have a working knowledge of some of this stuff. So I think for everybody that answered, very low to moderate, hopefully this last section will be something that you can look at. And even if you spend 5 or 10 minutes with it, you can gain a little bit of confidence in integrating data into your next presentation, whatever that looks like for you. So let's get into it. So there are innumerable resources around data visualization and data communication. And we wanted to share in the data playbook some of the fundamentals of this topic so that y'all can imagine your next presentation, really kind of integrate data well into it. And also we acknowledge that your presentation is probably not just a data presentation, but you might be communicating your overall prevention plan. You might be advocating for additional community engagement or funding. So take these principles and try and build these into appropriate places in whatever kind of presentation you're giving. So here we'll share sort of 3 key principles of data communication. There's more on each of these in the playbook itself. The first key principle is just using color intentionally. Color is kind of one of the foundations of data communication. And I think the common challenge is almost using too much color, where color can become distracting. So unintuitively, the starting place is if you're creating charts, graphs, if you're trying to visualize data, start with shades of gray. Shades of gray are great for creating structure. So what are the axes? What are the titles? And then move beyond that to use 1 or 2 colors to draw interest to particular parts of your visual. So we'll see an example here in a second, but you want to be thoughtful about those colors. Here we have a couple of examples. One is a sequential color palette and the other is a diverging color palette. So when you are thinking about the colors that you use in your graph, think about which of these 2 might be more appropriate based on the nature of the data that you're sharing. Sequential tends to be useful if we're sort of sharing data about one thing, Diverging is when we're often sharing data that sort of sit on extremes. So if we're asking people about their likes and dislikes, for example, a diverging color palette might make more sense. When you're thinking about color, so use shades of gray as a baseline, use 1 or 2 emphasis colors to sort of attract interest. Keep in mind that color blindness is actually pretty common. 1 in 12 men have some form of color blindness. So there are a few different tools that we share in the data playbook around how to check and make sure that your visuals are accessible for folks who have this. One is the Coblis color blindness simulator, and there are several others in there that y'all can check out. But be sure when you're creating visualizations, they're accessible in this way. So let's go to the next slide. So we talked about using color intentionally. The second principle is that less is more. When you're communicating a story with data, you want to just ask yourself, what's the main point of this chart in 30 seconds or less? And if the main point takes longer than that to explain, either edit down your explanation or break the visualization up into multiple components so that each component can be quickly understood. So I'm actually going to talk about this by just sharing an example. There are a lot of great writers about data visualization. The Storytelling with Data blog is one of the go-to examples here. And so I'm pulling an example with a couple of different charts. A less clear chart is on the left and a more clear chart is on the right. What makes the chart on the right easier to interpret? I think one, so we see use of color. We see 3 different colors in the chart on the left. We only see one on the right. And this author is wanting us to really focus on one particular series, the 2021 series, as opposed to the 2019 or 2020 series. So I think that's one difference. I think a second key difference between these that's instructive. So we're using titles in a meaningful way in this second example. So the key point, what do you want people to take away from this chart is, in this case, from 2019 to 2021, home prices have increased year over year. That's the key point, and it's in the title. So it couldn't be more clear. A third technique for less is more here is to remove any unnecessary structural elements. So in this, on the left, we see a bunch of grid lines. For example, we see a legend on the right. In the example on the right, we don't see the grid lines. And the series of data are labeled directly next to the series instead of having a legend sitting beside them. So that's just one example. I think the point here, the thing to walk away with is, could you really succinctly tell the story of this? And is there anything in this visualization that might be distracting, that might not help contribute to that story? So those are important principles to keep in mind when you're trying to communicate clearly and simply with data. Okay, and then the third, next slide here, the third point I want to emphasize is, you want to choose your chart wisely, and there are many different options, but it often makes sense to keep it simple. A table can be a fine visualization option. Bar charts tend to be really easy to interpret, and there are many others. So each different kind of chart is attuned to sharing particular kinds of data and particular ways of disaggregating data. So it's often easiest to just see some pictures, and actually the data playbook has pictures of each of these different kinds of charts. So you can imagine what might the scenario be that I would use any one of these. Like a dumbbell plot is the example here on the right. It's really great for comparing 2 groups or 2 time periods. So if some of the community data that you're emphasizing is doing that, is comparing 2 groups, you consider this as a way of sharing some of that. So you want to just be thoughtful about choosing your chart. There are so many different options. Several of the most common are in the data playbook, and we share a few different libraries if you want to go above and beyond to choose to really dial in, what's the right visual expression for the data that we have. So let's go to one final slide around data communications. So we were kind of talking about the mechanism of how do we just display data? And I think the point is, visualizing data generally is helpful, but visualizing data tends not to be enough in and of itself. You want to situate your data within a story. So I think thinking back to high school, we probably learned about how a story tends to progress. It tends to follow a narrative arc. Every story has a beginning, it has a middle, and it has an end. And if you're doing any presentations with data, you want to think, is there a way that we can build a beginning, middle, and end to this presentation? Often your beginning will be setting the stage. It'll be talking about, why is this data important, or why is our prevention planning team important? What was the situation that caused us to come together and do so much work? You'll have a rising action, something that is drawing people in, that's getting people to really care about whatever you're sharing with them. So this might be data about the challenges that your community faces, the things that you have discovered through engaging your community along the way. And then you have sort of a climax and a falling action. Often, towards the end of your data presentation, you may be really painting the picture of how people can become engaged and helping move your prevention plan forward. Again, this arc is going to really differ based on the nature of each presentation you're sharing, but I would encourage you to, whenever you're sharing data, think, what is the story that we put around this? So that we can, sort of capitalize on our natural ability to tell stories and to hear and remember stories, to remember the data that you've spent so much time collecting, analyzing, and engaging community around. So let's go to the next slide here. Just in summary, again, we have a data playbook for prevention action planning, 3 chapters, 10 sections. There's a lot in here, but I want to emphasize that it shouldn't feel overwhelming. Any of these sections maybe takes 5 to 10 minutes to read. So wherever your team is at right now in terms of engaging with data, would encourage you to maybe just go to that one section, read that section, and try and pick a few really tangible things that you could use to make your practice of engaging with community data that much stronger. Let's go to the next slide. You can access this by going to economics.safeandsound.org/playbook. So here you'll see these 2 links. There's one link for just downloading the data playbook, and then there's also an executive summary. And the executive summary really goes into, why is this important? What situation should you be accessing the data playbook in? So it's helpful for folks to really understand what the point of this is. So let's go to the next, and I think this is the last slide. What are your next steps around this? So I would love for y'all to share, you'll have these slides afterward, would love for y'all to share these slides and or the executive summary with any prevention planning team members that weren't here today. I really tried to just share, what are some of the key points? And these may feel basic to many of you, but it's the foundation for good, effective practice of using data to engage and understand your community. So share these with the rest of your team members. Would encourage at least one prevention planning team member to read the full data playbook. And the last thing I'll mention is that OCAP has been generous enough to really work with myself and one of my colleagues so that we can provide some technical assistance to counties around this. So if you want some technical assistance in integrating data into your prevention planning process, we would love for you to send just a quick email to this website. So it's FFPSA Prevention Services at dss.ca.gov. So send an email there and just say, hey, I would like some help in integrating data into our process. Please send that by Friday, 6/10, even if you don't know exactly what that should look like yet, because we want to just manage the potential requests and make sure that we can allocate our time in a way that helps as many people as possible move forward in a meaningful manner. What could that look like? I think we're pretty flexible. It could just be a one-off meeting, all the way up to, hey, we don't have any idea what we're doing with data for our planning team yet. Can you help us really go through each step of this process? So I think there's some flexibility. We'll have to navigate it together, but please don't hesitate to reach out, because we want to make sure that y'all are feeling comfortable in using some of these resources and integrating this into your broader prevention planning process. So with that, that is all I have. I was going to say, Lisa and Christy, thank you for the shout outs in the chat. I really appreciate it. I think we have a few minutes here for questions, and maybe I would defer to Lydia how much time we've got. I think we've got about 10 minutes by my watch.
Are there any additional trainings you suggest for getting more data analysis skills?
I think that there are a ton of resources in the data playbook in each of these different sections. So I might actually defer to that there. And Guadalupe too, if there's a particular kind of analysis that you have in mind, just direct message me, because I can think if there are some others, okay?
His work is very popular. I do want to highlight something that Justin from Annie Kesey Foundation highlighted about equity in data. And I think that that's probably a point that, especially as people are doing comprehensive prevention planning and looking at disproportionality, maybe what are some of the considerations that they should think about, or if there's tools or resources around that?
One of the starting points is just knowing we should look at equity, we should look at disproportionality. We should do something around that. So we need to be disaggregating data. So we're not just looking at county-wide metrics, but we're disaggregating by some dimensions that we have a reason to believe are important to us. And so generally that will be race and ethnicity, but it may also be age and the others that I mentioned. So I think just having that expectation, we need to disaggregate data. That's a good starting point. I think the second key thing I would mention is not jumping to the narrative of this is what the data says before trying to engage some community members or people who have experience with the conditions that are represented by that data to help validate that. And so I think that's where we talk about, kind of engaging community in a data party or engaging representatives on your planning team, but trying to get some community voice in there before we have sort of landed on this is what the data says, to help sort of gut check that, to make sure that it's not just our positionality, our point of view, that might be sort of separated from the actual feelings of community members. So I think those are the two things I would emphasize in terms of really trying to make sure that we're integrating equity, into our data practice.
Do you consider data points within different partner disciplines, for example, probation in data analysis, and data or research from those fields?
Yeah, absolutely. And there are some really cool examples when we talked with those 10 counties around the state of folks bringing their data sources from probation together with child welfare, together with the Family Resource Center, and sharing awesome resources across organizations that not everybody knew existed. So I think that's important. And, in this, we would recommend kind of starting with, what is that data framework? Is it the social determinants of health? Is it one of these other ones, the protective factors, the elements of a resilient community? But starting with that, because that framework sort of is broader than any of our departments. It really helps us think, okay, if we're trying to understand what our community needs, what are the data points that point towards that? Naturally, each of our departments are probably gonna have different data points that we can contribute into that framework. But I wouldn't use the departments itself as a framework, because what if somebody from probation couldn't attend the community meetings or the planning meetings, for example? I just, you want to be thoughtful around having a framework that isn't dependent on the voices that have opted into your particular room.
Jagdish asked an intriguing question. Also, what is the data not telling us?
Yes, absolutely. Jagdish, thank you so much for mentioning that, because I think that we mentioned representativeness. Any data collection activity is going to include some perspectives and is going to exclude some perspectives. It's going to be impossible for us to get the perspective of every single community member that we want to hear from. So there's always going to be something not said in whatever data we're looking at. And you're totally right. We just need to make some space for thinking about what could that look like. That doesn't mean that we can't use data to move forward. It just means that we want to be thinking about that and conscious of the limitations of whatever data that we've got.
Truly appreciate your time and the expertise you shared. We know that data can be tricky, it can be complicated, but I think that was just such a beautiful breakdown of, excuse me, how we can do this work and really share that information with our communities. All right, so the next thing we're going to do is we will be going into regional breakout sessions, which is why we had you put your county in your name. So hopefully you were able to do that. What we're going to do is we are going to have you all select which room that you will be going to. So please don't do that yet, so we can tell you what's going to happen. We will be, having facilitated discussions around what we've heard today, and these are the different regions based on counties. So we'll give you a minute just to make sure that you select the right region. If you happen to pick or select the wrong one, you can always kick yourself back out and we will help place you into the right one. But what you'll do is you will hit the breakout room icon below, and then you can select the room that you want to go to. So I think we can open our rooms now.
Okay, and I just want to say, Lydia, I'm sorry to butt in right here. If anyone doesn't have the breakout room icon, because I know that happens for some folks, you need to let us know in the chat what region you need to be placed into. And as soon as everyone self-selects, we will start assigning folks out to those rooms. Thanks. Please put it in the chat.
So only the people that do not have the breakout room icons, just because we don't want the chat to get cluttered with people putting their regions in who have the breakout button.
Thanks.
Welcome back, everyone. We hope you enjoyed your time in the regional breakouts and that you were able to learn from your colleagues who are engaging in this work already. So Barb DeGraff is one of our strategies TA consultants.
I think I've just been so impressed by what has been shared in San Diego County, just with how you've engaged so many of your community partners. So I just gives me a lot of hope, because I do think that we have a lot of community partners that are ready to assist and help in any way in Orange County. And I hope that, that's something that we have learned from this. So thank you. And I will tag Lee.
Hi, everyone. Lee Lombardo from the YMCA of Orange County. And I really appreciated, starting with yesterday, coming down, the messages that have been coming down from the state, which is that although the Families First funding targets a specific tertiary services, that not to forget a comprehensive plan includes a continuum of services and how important that is to reduce child abuse. And I just love hearing that, and that that is being looked for in this comprehensive plan. And I will tag Marlene Aguilar from Madera.
Hello, everyone. I'm Marlene Aguilar with Madera County Department of Social Services. I actually just started with the county about 2 months ago. I'm brand new to all of this. And so it was great to hear all of the passion from all of the speakers, the counties, and all the information that they were able to share with all of us. This looks like a huge project, and like somebody mentioned, it can feel like it's overwhelming, but I know that we have a lot of partners and partner agencies out there. I just recently came from the probation department, so I'm familiar with a lot of different people at a lot of different agencies, and so I look forward to bringing all of those agencies and people together to work on this project. And I look forward to working with a lot of you, because you have so much knowledge. And so I'm going to be reaching out to a lot of different people and just kind of gaining what I can from each one of you, because there's a world of knowledge out there. And I do appreciate all that you've been able to share with us.
I just wanted to weigh in to say, especially from my breakout group, just the transparency from everyone with regards to their level of questions. I'd like to commend OCAP. I think, you have opened the doors and asked for these transparent questions. Folks are asking about timelines and funding and various things that, we didn't always have discussions about a decade ago. So I just want to really not only commend the group, but commend OCAP, because this is truly, collective impact at its finest. And I will tag, I don't think there's anybody else. I could just tag somebody. I'm glad to see some of my friends too, like Lori Clark and Barb Finch and Carrie Collins. Good to see you guys.
That would not be trauma informed. Just kidding. But I think Robin Davis from Callejas had her hand up, and then Karen Potts is after that. So we'll.
Yeah, I just felt like it was really inspiring to hear from other counties about what they're doing, so we can kind of see the tail end of some of this, particularly El Dorado and Sacramento, and with braided funding, with bringing partners together, and just really gives me some hope for what we can do in our little counties based on what some of the other counties are doing.
So I'm Karen Potts from Siskiyou County, and I want to echo what others said about the other county, learning from other counties and the targeted focus on prevention. And I also want to recognize the powerful role of data and evaluation that we're talking about data before we start these systems, because I think it only will make us stronger, and the resources that will come with this are just phenomenal. I also want to share our appreciation that First Five was brought up. First Five's name was brought up multiple times, as well as family resource centers. We all know that, especially in rural, but throughout the country, family resource centers are key to community-based preventative services. And the stronger that they are, the stronger we are as a community and as a society. So the continued focus on that is truly admirable. And then as a First Five ED, I know that I can say that we're here because this is a mutually beneficial effort, and together we're only stronger. So if you're not connected to your local First Five system, I encourage you to reach out to them, and because it benefits all of us when we work together. Thank you.
Thank you, Karen. That's great. So unfortunately, we're just running out of time. So I'll have to close this out, but I think there's so many rich things in this chat that were shared right now just about the day today. And we just thank you all for your time and your passion and commitment to this work. We also want to bring attention to just completing this evaluation survey. So please, 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 this actually does inform us if we need to make any adjustments for tomorrow. So we highly encourage you all to please complete that. If you were at the day one yesterday, please, we resent the link, so please fill that out when you get a moment as well. It's very brief, as Sarah says. So tomorrow our agenda is we will do another welcome and recap. We'll talk about comprehension prevention planning readiness. We'll talk more in depth about the TA support that will be available for this process, as well as do more specific county breakouts. So there'll be more time to process the information and talk about future plans with your counties. So it'll be a nice time to just really connect with each other. So here are some contact information. If you have questions regarding FFPSA Part 1, there's an email that you can reach out to, as well as any additional information you can access the FFPSA website. So we look forward to seeing everyone tomorrow. Again, thank you so much to our presenters who shared some really valuable and wonderful information. So to Sheila, Michelle, and Paul, thank you so much for your time today, as well as the CDSS team, Kelly and Frenny as well, to share more information on FFPS and FFPSA. Thank you so much for joining us, and we look forward to seeing you all tomorrow. Take care.